Even around the most modern and well-maintained home, there is the potential for serious, even fatal injuries to occur. Each year, thousands of adults and children are seriously injured around the home. Most injuries can be prevented, while timely first aid treatment can reduce the extent of injuries and even save lives. In this video, we are going to outline certain safety measures and first aid procedures you can employ to help prevent accidents and reduce injuries around your home and save lives. But first, let's look at the basics of first aid. If you learn the basics, it'll help you to deal with a wide range of injuries. The major principle of first aid is safety first, both for the casualty and the first aid giver. Watch this video several times so you can be prepared before an accident or sudden illness occurs, and take a course in first aid or basic resuscitation. The basics of first aid are easy if you remember DRABC. This stands for danger, response, airway, breathing, and circulation. First, remove the injured person from danger, or the danger from them. Next, try to elicit a response from the casualty by gently shaking and shouting. If there is no response, move on to the ABCs. Make sure the airway is clear. Next, check if the casualty is breathing. If not, begin mouth-to-mouth resuscitation. After 5 breaths, check circulation by feeling for a pulse. If it is absent, and you are trained, begin chest compressions. You'll also need a first aid kit around the house, and it's a good idea to keep one in the car. Your first aid kit, carried or stored in a lockable container, could include such items as seen here. When you purchase your kit, complete a first aid course to become familiar with the contents and how to use them. The first step in avoiding injuries is to take preventive measures inside and outside your home. First, make sure your pool is isolated from the house by a fence that complies with Australian standards and your local council requirements. However, even with the proper fencing, you must keep the gate closed. Maintain the self-closing gate and supervise children at all times. When children are drowning, they cannot call for help. Drowning is a very silent tragedy. Always empty children's paddling pools when they are not in use. Install a device such as a gate alarm to alert you to the gate being left open or someone entering the pool area.
Don't forget.
Remember, children under the age of 3 are at the greatest risk from drowning. But children of any age can drown in a bath, spa, pond, even a nappy bucket. As a matter of fact, a child can drown in very little water. So never leave young children in the bath, even for a moment. Even when children are in the bath together, don't count on the older one to care for the younger. Be sure nappy buckets are covered with a secure lid and are stored out of the reach of little children. Your spa must be fenced or isolated from children. In the event of a drowning accident, be sure you know what to do. The important thing is to stay calm. Remember the DRABC. Remove the casualty from danger, making certain to put them on a level surface or where their head is lower than their feet. Try to elicit a response. Then clear the airway. Turn the person on their side. Turn their face slightly toward the ground to help drain obstructions from their mouth. Gently remove any obstructions from their mouth. Be aware, however, that in cases of suspected spinal injury, such as in diving accidents, minimize movement of the neck in any direction. The next step is to determine if the casualty is breathing. Breathing is checked by watching for movement of the chest and abdomen, or listening and feeling for escaping air from the nose and mouth. If they are breathing, let them remain on their side. If breathing is not detected, turn them onto their back. Now begin the mouth-to-mouth resuscitation. With children, this procedure must be carried out gently. Place the palm of your hand on the casualty's forehead and hold the chin with the forefinger and thumb of the other hand. Next, tilt their head back. The degree of head tilt varies depending on the age and size of the casualty. Take a breath. Place your mouth over the child's mouth. Gently inflate the lungs with air. Look for the chest to rise. If it does not rise, repeat the procedure for clearing the airway. Following your inflations, lift your mouth from the casualty. Watch the rise and fall of the chest, and with your ear close to the mouth, listen and feel for breath. After 5 breaths, pause to check the person's circulation. This is done by checking for a pulse at the neck. Place the pads of your fingers in the groove beside the Adam's apple on one side only. Do not use your thumb. If a pulse is detected and there is no breathing, continue mouth-to-mouth resuscitation. For infants and children younger than 8, blow 1 breath every 3 seconds. For anyone else, blow 1 breath every 4 seconds. If there is no pulse, begin chest compressions. The demonstration of CPR on this video is a guide only. Before performing this procedure, it is highly recommended that you complete a formal course in CPR. We also recommend that you check your child's pulse before an injury occurs, so you'll know where to locate it in the event of an emergency. After finding there is no pulse, kneel beside the casualty with one of your knees level with their chest and the other knee level with the head. Locate the lower end of the breastbone by running your fingers along the lowest rib each side from the outside inwards. Locate the upper end of the breastbone by placing a finger in the groove between the collarbones. Extend the thumbs of each hand an equal distance to meet in the middle of the chest. For children from 1 to 8 years, place the heel of one hand only directly below this point. Pressure should be exerted 15 times to a depth of 2.5 centimeters or 1 inch, followed by 2 breaths. This cycle should be repeated every 10 seconds or 6 times per minute. Every 2 minutes, you should stop to check if the breathing and pulse have returned. If the pulse returns, stop chest compressions, but continue mouth-to-mouth resuscitation. Once the casualty can breathe, nurse them on their side and urgently ring the ambulance. Remember, in the event of a drowning accident, you should remove the casualty from danger, try to elicit a response, clear the airway and check for breathing, begin mouth-to-mouth resuscitation, watching for the chest to rise between breaths. After 5 breaths, check their circulation by checking for a pulse. If there is no pulse, begin chest compressions. Nurse them on their side and call for an ambulance. Electricity certainly makes our lives easier. As a matter of fact, electricity is so commonly used that we tend to take it for granted. As convenient and essential as electricity is, it can still be lethal. That's why electrical safety precautions are important in every household. To help prevent electrical accidents, use safety switches. They turn the power off before people are injured when there is a fault. It is recommended that all homes have safety switches installed. Unplug appliances when you are finished using them and keep them out of the reach of children. Use appropriate plug-in covers to stop children poking things into power points. Be sure not to leave cords hanging where children can reach and pull them down, causing serious burns or other injury. Use electricity wisely. Never overload a circuit and always discard frayed or damaged cords, or have them checked and repaired by a qualified electrician. Have sufficient power points in your home to avoid dangerous overloading. In the event of an electrical shock, disconnect the person from the danger by turning off the supply if possible, or removing the casualty from the supply using a dry, non-conducting material such as a wooden stick. Avoid any direct contact with the casualty until they are disconnected from the power supply. As with the procedure in a drowning accident, try to elicit a response. Check and clear the casualty's airway. If there is no breathing, begin mouth-to-mouth resuscitation. The procedure is slightly different for an adult or child over the age of 8. For an adult, place the palm of one hand on the top of their forehead. Support the chin with the forefinger and thumb of the other hand and, firmly but gently, tilt the head backwards. Take a deep breath. Place your mouth over the casualty's mouth, sealing their nose with your cheek. Blow gently to inflate the lungs. Look for the chest to rise. If it does not rise, follow the procedure for clearing the airway. Following inflation of the person's chest, lift your mouth. Turn your head towards the chest and with your ear about 25 millimeters from their mouth, listen, feel and look for air being exhaled. Repeat this cycle once every 4 seconds for adults and once every 3 seconds for children. After 5 breaths, check for a pulse. In an emergency situation, if there is no pulse, the casualty will require chest compressions. Kneel beside the person. Locate the lower and upper end of the breastbone. Then locate the middle by extending the thumbs of each hand to meet in the middle of the chest. Keep the thumb of one hand in position and place the heel of the other hand below it. Your fingers should be relaxed, pointing across the chest and slightly raised. Place your other hand securely on top of the first. Lock the top thumb around the lower wrist. Exert pressure through the heel of your lower hand. Your shoulders should be above the breastbone and your compressing arm should be straight. Hand position used for this procedure will differ depending on the size of the casualty. As a guide, we've used ages, but these are just a guide. You should consider the size of the casualty to determine the best hand position for chest compressions. For children over 8 and adults, the breastbone should be depressed from 2.5 to 5 centimeters or up to 2 inches 15 times, followed by 2 breaths. This cycle should be repeated every 10 to 12 seconds or 4 times per minute. Every 2 minutes, you should stop to check if the breathing and pulse have returned. If the pulse returns, stop chest compressions, but continue with mouth-to-mouth resuscitation. Once the casualty can breathe, turn them onto their side to keep the airway clear. Then treat other injuries. Remember, the priority is to ensure the casualty is breathing and has a pulse before treating other injuries such as bleeding or burns. Remember, the first aid procedure for electrical shock is to first disconnect the casualty from the danger safely. Second, try to elicit a response. Next, check and clear the airway. Check their breathing and circulation, and resuscitate if needed. Call for an ambulance. And next, treat any other injuries. Burns and scalds can happen quickly and cause painful and long-lasting injuries. Take a few precautions and you can help prevent burns and scalds. Keep hot foods and liquids out of the reach of children, especially hot drinks. Do not leave hot water in the kettle. It will remain hot enough to scald for up to 30 minutes. Remember, foods coming out of a microwave oven may continue to get hotter once they are removed. So wait a short time before testing anything that's been heated in a microwave. Always turn saucepan handles away from the edge of the stove so they can't be accidentally knocked off the stove. Be careful not to place the handle over another hot plate where it will become hot enough to burn your hand. Use curly cords on electric kettles to help reduce the risk of children pulling down hot liquids. Put the iron up out of the reach of children to cool after use. And use suitable placemats instead of tablecloths that children can grab hold of and pull off the table. Keep matches, cigarettes and cigarette lighters out of reach of young children. Don't use petrol or other flammables to start barbecues. Teach children about the dangers of hot water so they won't turn on the hot tap in the bath. You can have hot water shutdown valves fitted into bathroom fittings or a tempering valve in the hot water line. Make sure that these comply with the Australian standards. Both products will ensure delivery of water is kept at 50 degrees Celsius, which is more than adequate for all home uses. They will also decrease the likelihood of severe burns and may save money on hot water heating. Most household burns are caused either by fire or by scalding from hot liquid. It is recommended that you have an appropriate fire blanket on hand to smother flames safely and effectively. In the case of flames, smother the fire using a non-flammable blanket. In the case of a scald, flood the burn area with cold water for about 10 minutes. Avoid overcooling the child. Remove loose affected clothing as it will tend to retain heat. If the area has been burned by flames, cover it with a loose, clean, dry cloth after flooding it with cold water. Once you have treated the burn, transport the casualty to a doctor or hospital by ambulance. It is important not to break blisters that form, and do not apply creams or lotions, as these make the assessment of a burn difficult and may need to be scrubbed off.
Alright, I put water on it.
Remember, the basic first aid treatment for burns is, first, in the case of flames, smother the fire using a non-flammable coat or blanket. Never use plastic. Cool the burn area with cold water for about 10 minutes. Remove any smouldering clothing, and in the case of burns caused by flames, cover the area with a loose, clean, dry cloth and transport by ambulance. Choking can occur in adults and children. In young children, chewy lollies and hard foods such as raw carrot, peanuts and apple are common causes of choking. Small objects like coins and buttons are also potential problems. As a matter of fact, anything smaller than a ping pong ball can cause choking problems for children. There are some helpful reminders to help prevent choking accidents. Don't walk or speak while eating. It is important to insist that children sit quietly when eating. With infants, grate hard foods like carrots and apples, and remove bones from their food. For very elderly people and children, be sure that food is cut into small, manageable pieces. Toys can be another cause of choking. Select toys from well-known manufacturers. Check toys for parts which are becoming loose. Choose age-appropriate toys for your child. Remember, toys labeled "not suitable for children under 3" generally means that there are small parts which can be swallowed. If the casualty is an adult or a child over the age of 8 and they can still exhale through the mouth or nose, encourage them to cough up the material. If the casualty is an infant or small child, look to see if the obstruction is clearly visible. If it is, remove the object with your fingers, but be careful not to inadvertently push the object further into the casualty's throat. Ensure your fingers are not bitten. If the object can't be removed, or if it is not clearly visible, sit or kneel and place the child across your thighs with their face down and head low. Use the palm of your hand to give a number of sharp blows between the shoulder blades to help shake the object loose so it will drop out. Obtain trained help from a doctor or ambulance officer to treat any injury that may have been caused by the object. Remember, in the event of someone choking, your first concern is to dislodge the object from their throat. Then seek medical help. Common accidents that result in bleeding can happen anywhere in and around the home. Keep sharp objects, such as knives, out of the reach of children. If installing glass doors, install safety glass, and be sure to clearly mark glass panels and doors. The sight of blood can be very distressing, but remember, stay calm. First, control the bleeding by applying pressure with a clean cloth, or if nothing is available, use your hands. Be aware that you may come in contact with contaminated blood and bodily fluids. For smaller cuts, apply an antiseptic solution to the surrounding area, but not directly to the wound. Direct application of antiseptic can be painful and may damage tissue. Make sure that any antiseptic is appropriately diluted before applying. Once the area is thoroughly cleaned, apply a dressing, maintaining direct pressure and bandage securely, but not so tight that it restricts circulation. For hand and arm injuries, place the limb in a sling, which will help keep the wound elevated and more comfortable. When the bleeding is difficult to control, or for large wounds, seek medical help urgently. First aid for bleeding follows a few simple steps. Control the bleeding point by applying pressure over the wound and elevating the limb. Clean and dress the wound. Apply a pad and dressing, then seek medical aid. Always try to rest and reassure the casualty. The loss of or damage to teeth through falls, roller skating, cycling and skateboarding is very common. There are simple steps you can take to help prevent falls and the possibility of dislodged teeth. Apply appropriate anti-slip treatments to stairs, pool surrounds and other areas. Make sure stairs are well lit and that children can reach the light switch. Make sure floor coverings are in good condition and insist that children not run around in slippery areas such as around a swimming pool or wet floors and paths. If someone has a permanent or second tooth dislodged, calm them, clean the mouth, find the tooth and clean it by having them suck the tooth clean with their own saliva or rinse it in milk. It is important not to handle the root. Grasp the tooth firmly by the crown and replace it with finger pressure if possible. The final step is to get the person to a dentist or hospital. If the tooth cannot be replaced, keep it moist in a jar containing milk. If milk is not available, place the tooth in saliva or water. It's easy to save a dislodged tooth if you act quickly to clean the tooth, but don't handle the root. Replace it, holding it in place with your finger, and get the person to the dentist or hospital immediately. Very small children are the most at risk from poisons around the home. You can help prevent accidental poisoning by following some simple safety procedures. Install child-proof latches or locks on cupboard doors. Keep medicines out of the reach of children, including things like tablets, which look like harmless lollies to children. Choose products in child-proof containers and keep your cosmetics well out of reach of children. Other common items that are highly poisonous include household cleaning products, kerosene and methylated spirits, solvents, swimming pool chemicals, pesticides and insecticides. All these things should be stored away from children and always store them in their original containers. If accidental poisoning does occur, you should check the casualty's airway. Check their breathing, and if breathing has stopped, be certain there is no poison around their mouth. Then begin resuscitation. In the case of an infant, place your mouth over the infant's mouth and nose. Gently inflate the lungs with small puffs of air from your cheeks. Look for the chest to rise. If it does not rise, repeat the procedure for clearing the airway. Always begin with gentle breaths sufficient to make their chest rise. After 5 breaths, check for a pulse and follow the procedure for chest compressions if a pulse is absent. For infants under 1 year, use 2 fingers directly below the midpoint of the breastbone. In the case of an infant, you should exert only enough pressure to move the breastbone 1 or 2 centimeters, or half an inch. Once they are breathing on their own, find the cause of the poisoning and contact the Poisons Information Center urgently for advice. The first aid treatment for poisoning, therefore, consists of the following steps. Clear the airway. Check the casualty's breathing and begin resuscitation if breathing has stopped. Remember to be sure there is no poison still around their mouth. If there is no pulse, begin chest compressions immediately. Once the casualty is breathing on their own, find the cause of the poisoning and call the Poisons Information Center on 131126. We recommend that you keep this number near the telephone along with other emergency numbers. We also suggest you find those telephone numbers now and post them near the phone. Remember to have the poison container with you when you telephone so that you can answer questions about the type of substance that's been ingested and how long ago it happened. Spiders, insects and snakes are among the biting and stinging creatures that make their homes in our gardens and parks. Children are more likely to suffer serious effects from these bites. There are some precautions that you can take. Keep the yard clear of logs and big branches. Insects, spiders and snakes tend to hide in or under these, and children tend to lift or reach under them. Keep a first aid kit handy and take it with you on picnics and trips to the park. Learn which local snakes and spiders are lethal. In the event of a snake bite, it is important to stay calm and calm the person. Panic or movement will cause the casualty's heart rate to increase, spreading any poison through the system faster. Send someone to call for medical assistance while you begin treatment. Immediately apply a firm pressure bandage over the bite. If bandaging is unavailable, you can use clothing. Wrap it around and beyond the site to the tips of the fingers or toes, then back along the limb to include the joint above. Do not wash the wound, as any venom on the skin will be useful for identification once medical assistance arrives. Firm bandaging over the bite will limit the spread of venom. The spread is further reduced by keeping the casualty's limb still. The bandage should be only as tight as one applied to a sprained ankle. Remember, keep the limb as still as possible and do not elevate the limb. Once the bandage is in place, immobilize the limb completely by binding a splint to it. You can use any rigid object such as a stick. If the bite is on the hand or forearm, put the splintered forearm in a sling. Once treatment is completed, observe the casualty until medical assistance arrives. If breathing stops, commence resuscitation procedure. Remember, in the event of a snake bite, immediately apply a firm pressure bandage over the bite. Keep the limb as still as possible while bandaging. Immobilize the limb after bandaging and seek medical assistance. The treatment for the most venomous spider bites, such as the funnel web, is the same for a snake bite. If bitten by a redback spider, apply ice over a cloth to prevent damage from direct application of ice to unprotected skin, and seek medical advice. Seizures, sometimes known as fits or convulsions, may take many forms. Seizures can be brought on by epilepsy, head injury, some poisons, or where the blood and oxygen supply to the brain is impaired. In infants, seizures can be the result of a high body temperature. Remain with the casualty, removing any objects that may cause injury, and move the casualty away from any danger. Wait for the seizure to subside, then perform the ABCs of first aid. Check and clear the airway. Check their breathing, and then check their circulation by feeling for a pulse. When possible, turn the casualty onto their side, tilting the head back and supporting the jaw with the face pointing slightly downwards, in order to keep the airway clear. Loosen any tight clothing. Do not force their mouth open with any hard objects, as this may cause more damage than tongue biting. Use only enough restraint to protect the person from injury. Remember, if someone is having a seizure, first and foremost, remain calm. Stay with the casualty. Clear the airway as soon as possible. To keep the airway clear, turn the person onto their side and control any bleeding. Any person who suffers a seizure should be transported to a medical facility by ambulance. When you telephone 000 for assistance in any emergency situation, stay calm. State the type of injury or illness, such as bleeding, heart attack, or other description. State the number of people needing assistance. When you give your address, remember to include directions with the nearest cross street, any distinctive features of your house, and give your phone number in case the emergency service has to contact you. And finally, clear the entrance to your house so ambulance and medical personnel can gain easy access. Remember, in any emergency situation, stay calm and use the DRABC. Remove any danger and try to elicit a response if the casualty is unconscious. Clear the airway, check breathing and circulation, and perform the appropriate first aid procedure. The best way to ensure that you can administer first aid safely and effectively is by enrolling in a first aid training course offered by an appropriately authorized organization. You should also use this video to increase your awareness of potential dangers and as a review of first aid procedures. For information on how to prevent accidents around the home, contact the Kids Safe office in your state or territory. Remember, this video alone is not a substitute for a detailed first aid course. We encourage you to complete an accredited first aid training course.